Question 1. A 7-month-old boy is brought to the pediatrician due to recurrent ear infections and several episodes of diarrhea over the past 2 months. He was born at term without complications and was healthy until recently. Family history is notable for a maternal uncle who died in childhood from severe infections. Physical exam reveals scant tonsillar tissue and no palpable lymph nodes. Lab testing shows IgG, IgA, and IgM all markedly decreased. Flow cytometry, absent CD19 plus B cells. T cell levels, normal. Which of the following is the most likely underlying cause of this patient's condition? A. Defective class switching due to AD mutation. B. Impaired neutrophil oxidative burst. C. Mutation in a tyrosine kinase important for B cell development. D. Mutation in T cell IL-2 receptor. E. Complement component C3 deficiency. Correct answer C. Mutation in a tyrosine kinase important for B cell development. Explanation: this child has X-linked agammaglobulinemia, Bruton disease, due to a BTK, Bruton tyrosine kinase, gene mutation, leading to failed B-cell maturation and immunoglobulins all classes. Symptoms begin after 6 months, maternal IgG wanes, and lymphoid tissue, tonsils, nodes is scant. AA. Class switch recombination defects cause hyper-IgM syndrome, not all IG. B. Neutrophil dysfunction, chronic granulomatous disease. D. IL-2 receptor mutation, SCID-E. C3 deficiency, recurrent bacterial infections but with normal B cells. Question 2. A 5-month-old boy is evaluated for persistent bacterial respiratory infections. His mother is concerned because he has not developed tonsils and seems more prone to illness than her older children. Lab results show serum IgG, IgA, IgM undetectable. Peripheral blood smear absent. B lymphocytes. T cell counts normal. Genetic testing BTK gene mutation. Which of the following vaccinations is contraindicated in this patient? A. Tetanus toxoid. B. Inactivated polio vaccine. C. Pneumococcal conjugate vaccine. D. Oral rotavirus vaccine. E. Hepatitis B surface antigen vaccine. Correct answer: D. Oral rotavirus vaccine. Explanation: live vaccines are contraindicated in Bruton agammaglobulinemia due to the risk of uncontrolled infection, especially in the absence of B cells. The oral rotavirus vaccine is live attenuated and should not be given. A, B, C? These are inactivated or subunit vaccines and safe. Question 3. A 6-year-old boy with a history of multiple bacterial sinus and ear infections presents with another episode of otitis media. He has received IVIG therapy since infancy for a known immunodeficiency. Physical exam shows underdeveloped tonsils. Lab results reveal serum IgG, low without IVIG, B cells absent, T cells normal. What is the most likely reason for the late onset of infections in this patient, despite a congenital condition? A. Infections only develop when the child is exposed to daycare. B. Antibody levels from maternal passive immunity protected the child at birth. C. The condition has a delayed onset in genetically predisposed individuals. D. Viral infections suppress B cell function in the first year. E. Normal T cell function compensates for early infections. Correct answer: B. Antibody levels from maternal passive immunity protected the child at birth. Explanation: maternal IgG crosses the placenta and provides passive immunity for the first 6 months. Symptoms of Bruton agammaglobulinemia usually begin after maternal IgG wanes. A. Daycare increases exposure but doesn't explain immune dysfunction. C. Bruton disease is present from birth, not delayed onset. D. Viral infections don't suppress B cell production here. E. T cells help but cannot produce antibodies. Would you like